combat casualty care. I'm going to go ahead and share my screen so everybody can see the slideshow that we'll be doing. Today, the course is called Stop the Bleed. This is a legitimate program put together, and you'll see some of the committees that have been behind this development of the course. Stand by. Okay. We'll get to it. Like I said, my name is Justin Roberts. There's information, and you can see there on the screen also some of the committees. The Committee on Trauma, the American College of Surgeons, and the websites on the bottom left there, bleedingcontrol.org or stopthebleed.org, websites where you can go to get some of this information. Like Jake was saying, this training applies to everybody. I'm glad to see so many different backgrounds of people in EMS, nursing. I think I saw a nephrology nurse. This course is geared towards because emergencies can happen anywhere, and the #1 preventable cause of death is bleeding to death. Again, the American College of Surgeons. Some more committees behind this, the College of Emergency Physicians, the National Association of EMTs, and the Committee on Tactical Combat Casualty Care. All these people get behind this program. Disclaimer, I don't think this slideshow has any disturbing images. And like I said, the #1 preventable cause of death after injury is bleeding. Anybody can use this. You know, it's not just in those terrorist activities or active shooters. You know, I've seen a traumatic amputation of a leg from a car accident, a motorcycle accident. In the office, if you cut yourself with a paper cutter or stick your hand in a shredder, you know, these are all pretty random causes that can make someone bleed. Goals. #1 will be to identify life-threatening bleeding. The two categories of bleeding would be divided in between arterial and venous. Arterial being the bright red and spurting, pulsating with each heartbeat. The venous being darker and oozing, where it's not as rapid. But keep in mind that just because it's not as rapid doesn't mean that it's not life-threatening. If somebody has a medical condition that prevents their body from clotting and stopping that bleeding, they can continue to bleed out from a venous bleed as well. Step 2, #2 goal is stop it. You know, you can use direct pressure, packing, and tourniquets. These are all steps that we'll go a little bit more into. For the EMTs, they teach us scene safety. Your safety is the first priority. And like the slide says, if you're injured, you cannot help others. So some people may just want to run in to help as many people as they can, but keep in mind, you can't help if you injure yourself. And this applies to everything, not just if someone's bleeding. If the situation changes after you start trying to help, becomes unsafe, just stop. I mean, if it's possible, if it's feasible, if you can, try and take your casualty, your patient, or your victim with you. Just know your limitations. Again, safety being a priority. Wear gloves if you can. There's a lot of things going around. You know, with this COVID thing, you might make sure that you have a mask on, they have a mask on. That way you're not swapping any
Excuse me,
bodily
Justin.
things on you or something.
Excuse me, Justin.
Yes.
Justin.
Excuse me, Justin.
Yes.
We can't see your screen. Can you just share it with us? I think there's a problem with your screen. We can only see your face. Yeah, just share it with us.
I apologize.
Okay.
The training. Control bleeding.
Well, I'm getting back to it. My apologies, guys. I don't know why it's not working.
It's not working?
Stand by. How about now? Do you see a motorcycle?
No.
No? Goodness gracious. I don't understand.
Have allowed you.
Yeah, I mean,
Try now. Let me see. Can you be able to share it, Justin?
say again?
Can you be able to share it?
Yeah, it lets me click on it. I don't know why it's not sharing.
Let me try on my side. Let me see. Let me try on my side. You know, sometimes the system works against us.
Yes.
Yeah. Let me see. So can everybody see that?
Yes, we can see.
Okay. Okay. Yeah, Justin, just tell me be saying next as we move forward.
Jex, we can see
Hello?
some documents. However, the presentation has not yet opened.
How about that? Is it opening?
No, we're just seeing 4 documents.
How about
Now we can see.
now you can see?
Yes.
Okay. All right. Now, Justin, just be telling me next.
All right, I will do. Thank you, Jake.
You're welcome.
All right, so we're going to
yourself.
close the first part of this. Go ahead and hit the next slide, Jake.
Okay.
Like I said earlier, in the bottom left there, the website's bleedingcontrol.org, stopthebleed.org, and the committees. Next slide, Jake. Go ahead and hit the next slide. Number 1 preventable cause of death, injury is bleeding. Next slide. Like I said, everybody can use this training, knowing what to do in the right situation to try and save a life. Those the pressure packing and tourniquets, these are things you can do to stop the bleed that we're going to cover. Next And your safety is your first priority. Already covered that. Next slide, please. If you do happen to get blood on you, be sure to clean any part of your body that the blood's been on, you know, using water and soap. Wear gloves and a mask if you're concerned about the COVID spreading. Next slide, please. The ABCs of bleeding control. The next slide, please. There you go. A, being alert. Call emergency services. Call for help. Especially with a chaotic event. It's great to try and help out, but be aware that you may need some more resources. An ambulance or some sort of police to try and block traffic in an accident or something. Be aware of where you are. That way the dispatcher or whoever you're talking to knows where to send his resources. Next slide.
Oh.
Next slide, Jake.
Oh,
Just
just-
kindly mute your phone.
Yes.
Except Justin.
yeah, just hold, just for hold. The issue is I am muting them and then they are unmuting themselves. That's the issue I'm facing right now.
Okay.
Okay.
Yeah, Gideon.
Sorry.
Yes, Gideon, I've made you the co-host. So be doing it on the other side because I'm doing, then they are meeting me.
All right. And the B in the ABCs of bleeding control is bleeding. Again, the first step is you want to identify the bleed. If you're in a situation where you can, expose the site because you can't treat what you can't see. So you need to identify it. Next slide, please. And like I said, there's different kinds of bleeding, the arterial, continuous and pulsating, or it could be venous, more oozing, and still be large volume. And you can look for signs, you know, if somebody's wearing layers of clothing and you can see blood through their clothes or pooling on the ground or wherever they are. Keep in mind, you know, in the civilian world, you know, just driving to work or at your house, whatever, there could be pediatric patients, the kids of the world. Keep in mind that the kids are not just tiny adults. You know, they have a lot of different physiology with them, including the blood volume. So for an adult, if you lost your, the average adult male has 5 liters of blood. If you lose half of that, you know, 2.5 liters, it's likely that your casualty will die if they lose that much. But for a child, from the research I've done, they have about 75 to 80 milliliters per kilogram. Okay, so for an 18 kilogram patient, or 40 pounds, they have about a liter and a half. So, I mean, if you think about just the size of the container, it's very small in relation to adults. So keep that in mind if you have a small patient. Next slide, please. And there may be multiple places, depending on what kind of situation it is. Active shooter or an explosion of any sort. There may be a bunch of shrapnel injuries. You need to be able to expose what you can to be able to identify all those sites. And like I said, clothing may also hide some of it. Next slide, please. So the sites of bleeding that we can try and control, it's going to be the arms and legs and the neck, armpits, and groin. Arms and legs are definitely sites that you can apply a tourniquet if it's needed, and we'll get to that later on. The neck, armpits, and groin is what's referred to as junctional areas. Those spots you cannot put a tourniquet on, but also because it's closer to the core of the body, closer to the heart, those areas contain the larger vessels. So if there's an injury to one of those sites, an injury to one of those vessels, you can bleed out a lot faster. If you have a severed artery, one of those larger vessels, you can bleed out in as little as 3 minutes. And that is not a lot of time. So again, we're trying to get this training to everybody, so if this situation rises, you can act appropriately, calmly, and achieve your goals here of stopping the bleed. As far as the body goes, if they're injured in this area, it's what we call a non-compressible area, non-compressible injury. That there's so many other things going on in that red circle on the right that you can't really put a whole lot of pressure on. If it's up in their chest, they won't be able to breathe as easy. And in the abdomen, because of how the diaphragm moves to help you breathe, you just can't put a whole lot of pressure on it. Next slide. So the C in the ABCs of bleeding is compress, put pressure on it. A lot of wounds and injuries, you can control bleeding just simply with pressure. If it's arterial, that bright red and spurting, if you can identify where that spurting is coming from, if it's just a small hole, get a finger in there and put some pressure on it. It's a very simple maneuver that can limit that bleeding. Next slide, please. You want to apply direct pressure to the wound. Focus on the location of the bleeding. Like I said, if you can identify where it's bleeding, apply pressure to it. You want to use just enough gauze or cloth to cover the injury. And if pressure stops the bleeding, keep pressure on the wound until help arrives. Again, that first thing you want to do is call for help. Worst case scenario is you aren't able to control that bleeding, but still help arrives, and you can get your patient to more definitive treatment, being a surgical suite. This class is also for the layperson. I'm not entirely sure if anybody in this class is not medically trained. So I apologize if I use any medical terms or something that you're not too familiar with. Let's see. Next slide, please. This is a little video on how to apply pressure. Does it work for you, Jake? There you go. Okay. There is no sound, so we're just going to talk through it. So the wound is exposed, you can see it, and you've identified where it is. Ideally, you want to take gauze, but if all you have is a t-shirt laying around, you can use that to cover the wound and apply pressure to it. I feel like we skipped some slides there. You want to go up a few more slides, Jake, please?
Yeah, that's where we were. Oh, right
Okay.
there. Right there.
Yes, there we go. That's it. So applying pressure to a wound, if it's superficial, meaning it's not very deep, that will work wonderfully. For the deeper wounds, as you can see in this picture in the right corner, putting pressure just on top of the skin for a deep wound like that is not going to be effective. So you need to pack it. This should be with gauze. And again, if it's arterial and you see that spurting, try and put pressure on that. And if you happen to have specialized gauze with the hemostatic agents, it's something that'll help the blood clot. There are a couple different kinds out there. But even just plain gauze will work. You just have to keep pressure on it a little longer. Next slide. We've got another video that's going to show us how to pack a wound. So again, you got the exposed injury. Looks like a laceration. And in the video, you got our gauze. Just
Justin, we are losing you.
Can you still hear me, Jay?
Yeah, check your internet, Justin. Checking.
I'm still connected. All right. So, you have to turn it on.
Ooh. Check your internet, man.
I'm connected. I've got a good signal here.
Okay, try now.
Jax, can you hear me? Hello, Jax.
Hello?
Can you hear me?
Yes. Yes, I can hear you. I think he's having some issues with his connectivity. Okay,
So where are
so
we now? I can help out.
yes, so we are the ABCs. You are on the current slide as we wait for him to come back on.
Yeah, so I can see compression packing.
Okay.
So I'll just carry on from there, and then when he comes in, I'll let him in, and he'll carry on.
Okay.
Okay, so if I can ask somebody to continue admitting people, because that's what I was doing as a co-host.
I'll do it on this side.
That's perfect. So as Justin was saying, it's about compression packing. So we normally have we call them long limbs, so the arms and the legs, and then we've got the neck, the armpits, and the groin. So when it comes to arms and legs, that's when you're going to use a tourniquet. You're going to talk about the tourniquet. You need to stop the bleeding from there. And then because you can't use the tourniquet on the junctional areas like arms, neck, and groin, then you use a echelon. And then we have the body, which is the trunk, the bit between the thorax and the abdomen. So go to the next slide, Jakes.
Okay.
Yeah, we said about the tourniquet. So for the tourniquet, the first thing you want to do, you want to apply 2 to 3 inches above the wound, obviously towards the body, so that you stop that bleeding. Again, do not place over the elbow or the knee. So if it's any injury and below the knee, you want to put, if there's space below the junction or below the knee, you put the tourniquet there. If there's not enough space there, then you go above the knee. So you want to have it very tight, because that is what is going to save this patient from bleeding to death. You tighten the tourniquet until the bleeding stops. And I'll have to tell you this from experience, obviously being a medic on the ground, this is why it hurts most. Getting blown up and everything else, or even getting hit by a car, adrenaline is already kicked in. But when you're putting a tourniquet to stop the bleeding, the victim or the patient is in pain, and they will cry and they will try and punch you, but just go on with it, because you are doing it they will thank you later. Next slide, please.
Okay. Tirus.
Yes, mate.
Yes. So people in Kenya, they don't have tourniquets. So what can they use in the absence of?
So good question there. So
Okay. So Tirus, we
the
lost you too.
tourniquet. Oh, can you hear
We
me?
lost you too. Yeah, we lost you like 30 seconds ago.
Yeah, can you hear me now?
Yes.
Right. So what I was saying is, if somebody gets an injury and they're spatting out, where the arterial bleeding is coming, and you can see it's like a tap coming out, we need to stop that bleeding. We have everyone, and I'm sure everyone wears a belt or a lasso, anything that you can actually get hold of. Tighten it. Put a pencil, put a timber in it, and start twisting it. You twist it and you twist it until you can physically see the bleeding has stopped. So we have to improvise. That is improvising. So you put a tourniquet. If you don't have a tourniquet, you put a belt. If you don't have a belt, you have a tie. If you don't have a tie, you have a piece of cloth. Just cut it, tie it across, and use a tourniquet effect. And then obviously use the rod. You anything that, whether a metal rod, a wood, anything that you can actually put between the cloth, and you start twisting so that you can actually stop the bleeding. Next slide.
All right.
Yeah, so compression tourniquet. So this one is self-help. If you don't have anybody to come and help you, you can actually use a tourniquet to yourself. Obviously, if you go injury on your leg, you have your hand, use your hand to use a tourniquet. If not, if you can see a bystander, ask them to come and tell them, because not everyone will know what to do. Tell them, because it's either you do that or you end up dying. And like I said there, it's actually in capitals, tourniquet hurts. If you put the first tourniquet and it hasn't stopped the bleeding, you want to put another tourniquet or a cloth or a tie above, obviously close to the body, above the first tourniquet. Until, again, you do the same thing you did on the first one until the bleeding stops. Next slide, please.
So yeah, it's a short video on how to do it.
Yeah.
So I watch it.
So that one there, you can see someone is helping them to put a tourniquet on. So you want them to put a tourniquet above where the injury is. And then you twist it. So you can see the metal rod there, or the plastic rod, and that's the tourniquet effect now. You are tightening it, and this is why it becomes very, very painful. And then you lock it. You lock it into place. And then for the medics that we have, we need to know the time that we done that. Again, because you are thinking of saving the limbs, you don't want to deprive the other part of the body so long to have this ischemic effect. So if you can, I know those people who are trained, they can release it as time goes. But if you are not trained, just leave it in place until the helps, medical professional arrives. So that's the tourniquet there. You can see I'm not going to go into detail with that, but like we said, if you don't have the tourniquet, use what you have. Use what is available with you. If it's not a belt, you probably have a tie. If it's not a tie, we have lassos, a cloth, a t-shirt. You just need to cut a piece and improvise.
All right, so.
Okay, yeah, so bleeding control in children. But extreme young children, the same tourniquet used in adults can be used in children. For infants, those very small children or very small child, tourniquet are too big. So use a direct pressure. You can even use your hands to, the bottom line is try to see that there's no bleeding, that bleeding has stopped. So if you have to use your hands, use your hands. If you have to improvise and get a tie, you use whatever you have available. At the same time, guys, when you're doing this tourniquet effect, remember to elevate leg, because you don't want to have the gravity going down and working against you. So if, for example, they've lost a leg, you want to elevate that leg so the gravity is working with you. At the same time, use a tourniquet effect. Okay. So
Yeah,
treat children
can you talk about,
like you can do to adults. Yeah.
Yeah, so can you talk about for large deep wounds, how they can do the wound packing?
So for the wound packing, again, if you have we call them what do you call it? We call them sell-offs. If they have a sell-off or a bandage, just try and pack it in, because if you don't pack it, it will continue bleeding. So if you have anything that you have, whether it's a t-shirt or a lasso or anything, just cut it and pack that wound, because what you're trying to do is it's like you're trying to fill it up. Think about like a sand. If you have a sand and there's a hole and it's still coming out, before you realize that sand, that the sandbag will be empty. So you want to plug it in, but not just from the outside, but from the inside as well. So put whatever you have, pack it in, and then use pressure as well. So for example, for an open wound, have whatever you have. If you can fill it in, then put pressure. You want to put that direct pressure for maybe 2 to 5 minutes, or until you see the bleeding stop. There's 99.9% of bacteria and viruses, including coronavirus. So that we have there. That is what you got. In addition to bleeding control,
Hypothermia.
The stuff yeah. So one thing I would probably want to mention on this, it's the blood, especially when you're cold or when you start bleeding. The first thing you notice you become hypothermic, or your body temperature goes down, because we need blood to circulate the oxygen that we need, but at the same time to give us warmth. So if you lost a lot of blood, it means you've lost that capability to keep you warm. So the other thing that people forget quickly is this patient, they are going to get cold. At the same time, the blood has come out and it's gone on their clothes. So assume or imagine you wearing a cold, wet clothes. They are going to make you even colder. And then, there's a wind blowing and everything else. So remember, these people, they are more vulnerable to go into hypothermia. And then once they go to hypothermia, the body's ability to clot, it becomes impaired. So it's like a vicious catch-22. So one thing affects the other. So you want to stop it before it gets to that level of something has gone wrong. So that's why you can even see there's a blizzard blanket. You want to cover them to keep warm and to retain the little energy or the little thermal energy they have.
So what will they do if somebody doesn't have a thermal blanket?
If they don't have a thermal blanket, you have a bystanders. Everyone, they are wearing clothes. From experience, again, in December, I had an accident. I happened to be in the vicinity of an accident. The first thing I did when I stopped the bleeding, I asked for people to give us jackets, give us whatever they can afford for this patient. So whatever you think of, if someone is wearing a nice puffy jacket, ask them, and because the patient needs it more than them. So you can use that, or you can use any plastic sheeting, because all you're trying to do is you're trying to prevent the body from losing extra heat. Okay. So again, that goes without saying. Avoid hypothermia. It goes without saying there. So with whatever you have available, improvise, guys. So again, there's something about remove, if you can, try and remove the wet clothing, because imagine yourself having the wet clothing and you're trying to keep warm. That doesn't happen. So you can strip them. Don't worry about doing it at this time. You can strip them all the way to the underwear, then borrow people's clothes, and put them so that they can keep warm. Okay. So we're talking about the chest seal. So chest seal is when somebody has got they've got injuries to the chest. So the first thing that will get affected is the way they breathe. So you need that gaseous exchange. So you need the rib cage, if you may. You need the ribs, and you need the diaphragm to work in unison. So when there's air escaping through the membrane, then breathing becomes a problem, because you need the pressure when you breathe in. That the inhalation you do, it pushes the diaphragm down so that it can create more pressure for the lungs to get the oxygen, so that the oxygen can be used by the body. So when you lose that ability, or when there's an air escaping through, whether you have a gunshot wound or a through and through wound through the chest, that's when you need to use something like a chest seal. That is something that I'm sure all the medics in the house, they will understand. If you don't have that, you can have a bag or a paper wrap or anything, so that what you're trying to do is plug that hole. Yeah. So the first thing you want to do, you want to clean the area, then get a plastic tub, peel the backing from the seal, apply on the wound adhesive side down, centering the vent over the wound. So that is your valve, because you want the valve to be working, and repeat for the chest wounds. Evaluate the patient for improvement. Of course, anything could happen very, very quickly, and patient condition could worsen. Okay. If you worsen, feel free to remove the chest seal and readjust it again.
Mr. Sean Vok, just for a minute, Mr. Sean Vok, can you explain the same using American medicine?
What was that?
Can you explain that slide in American medicine? How about we go about chest tension, pneumothorax, and how we prevent it?
How do we prevent chest pneumothorax?
Yes.
How we prevent it? If we start to identify early signs and symptoms of it in the event of blunt force trauma or penetrating into injury to the thorax. If they start feeling restless and they start having
Sean, you're muted.
Was it the whole time, man?
Yes, you have to repeat everything you said.
Oh my goodness.
Blame it on
yeah.
the host.
Okay, so was the question how we treat tension pneumothorax?
Yes, and how we we address the chest wounds from American medicine.
Sure, yeah. If we come across somebody that has a chest wound, if whether or not it's sucking, but if it's a wound, penetrating wound, whether it's anterior or posterior on the chest or on the back, how we treat it usually is with a 3-sided occlusive dressing. It can be one that's a company-made one, or if you can be innovative and use anything that's not permeable, like Saran wrap. Saran wrap works good, or Tegaderm from IV start kits. Anything that will occlude that wound and prevent air from moving in upon the patient inspiring or breathing in, and then air gets trapped, sucked in through that wound into the chest cavity, which will accumulate and add pressure onto the major vessels in the chest and onto the heart and onto the unaffected lung. Once you start seeing that blood pressure starts to decrease, patient becomes more restless, O2 sats are going down, cyanosis is developing. You can burp that, we call it burping, by lifting aside of that occlusive dressing to allow air to escape upon exhalation. And then upon identification of a tension pneumothorax, we use a 3 1/4 inch needle, about 14 gauge or a 10 gauge, second or third intercostal space, mid-clavicular as the preferred site, secondary site, which I believe would be preferable in the event of a hemopneumothorax if you have the ability to do a chest tube, 4th and 5th anterior axillary line. And yeah, did that answer the question? Caught me off guard.
Yes, precisely. A lot of medical terminologies, but you good. All right. Yes, good though. You good though. So Tirus, let's continue.
Yeah, well, yeah. So thank you very much, Sean. That is quite in depth. I'm sure you appreciate, a lot of medics in the house, they will appreciate that. So in short, that was how to prevent tension pneumothorax and how to treat it. Next slide, please. Okay, so frequently asked questions about the impaled objects. So obviously, especially if you have like abdominal injuries and you've got something that is protruding, our advice is from the medical, well, especially in the British Army, advice you keep it in situation and you wrap the band around it, and then obviously you let the medics in the hospital while in the proper setting to deal with it. Improvised tourniquet, we've gone through the improvised tourniquet. So we spoke about ties, kangas, belts, anything you can get hold of, t-shirts, just improvise. But all you're trying to do is to create that tourniquet effect. So if you got loss of arm or legs, don't panic, because remember the patient, they will borrow from what they can see in your face. The first thing you need to do, you need to know you're not the one in pain, you're not the one who is almost dying, it's them. And then if you panic and they're already in a panic mode, you're not going to help anything. So put the best brave, the best brave face you can ever get, and go and attack whatever you need to do, or go and do whatever you need to do to save people's lives. Like I said, if they're spotting out, they lost a leg, you put a tourniquet in and make sure if you need to put more than one tourniquet, do so. Again, be careful, because I said tourniquets are very painful and they will hurt you at that time, but they will thank you for the rest of their lives, and you have saved their lives. Pain, it's painful. It's very, very painful, especially when you're putting tourniquet. That is where they feel. From my experience, I've seen people losing their legs. They say losing a leg wasn't as painful as applying a tourniquet. Obviously, I've never lost a leg, but I'll believe them, because they know how much the pain they felt when they lost a limb, and they knew how much pain they were in when I was applying those tourniquets. Unless Jake unless anybody has got any question, I don't think I've got anything that I need to discuss or elaborate.
And then, okay, so, and how will they manage the pain? Can they give anything?
So for the pain, yeah. So for the painkillers, what we normally do, if I'm a paramedic, I'm going on scene, I'll have my morphine. I don't know if you guys are allowed to use ketamine, or you can go as very basic. You can start with fasting. The first thing you do is sprintage. Sprintage is another form of pain relief. So you need to sprint a leg if it's broken, if it's fractured. So sprinting is the first line of pain relief. Then you do the staircase pain management. So you start with say codeine or paracetamol, then you go to codeine, then you go to opiates, and then you titrate it that way. And then obviously you get to morphine and ketamine. And then again, remember when you go to opiates, when you're talking about morphine, that can cause the reverse effect because it's a respiratory suppressant. So you don't want to put them to sleep, to sleep forever, but you want them to be at ease with pain. But again, remember about the contraindication, because if somebody is struggling to breathe and then you're giving them morphine, then it's going to go against what you are trying to achieve. So in short, you do the staircase approach when it comes to analgesia. So you use the what did I say? You use the tourniquet, use the sprintage, tourniquet, sprintage, up, and then you go up the ladder to the opiates.
Yeah, so for people in the house, what can they use for pain management? Because I know they don't have morphine or ketamine.
So we can start with well, good question. We can even start with paracetamol if they have paracetamol in the house.
Okay.
You know, paracetamol. We have ibuprofen. But I'm not assuming they will have Entonox because obviously they don't keep gases in the house. And then obviously this patient they need to go to the hospital, and reassure them, because at the end of the day, the least you can give somebody in pain is tell them everything will be fine. You know, try to give them that good thing to hold on to.
Okay. So for impaired object, yeah, you at least need to hammer home that if somebody has an impaired object, don't try to remove that impaired object.
Exactly.
The best thing you can do is to stabilize it until they get to the next echelon of care. Yeah, because you can cause more bleeding, you can rupture veins, arteries. So if somebody has a knife in them, don't try to remove that knife. Stabilize that knife around it and then transport to the next hospital. Don't try to do that at home. Okay?
Yeah, good. Also, one thing they need to know about the clotting factor. So the fast clot of in anything, the fast clot is always the best. So the more you keep moving this object, you're actually dislodging the clot, and you're actually sending the body again to go back and do the clotting system again. And it's very tiring for the body to do that. Obviously, like I said, the fast clot is always the best. So if they manage to get the clot around the knife, or if they manage to get the clot around the object, leave it in situation, put a bandage around it, and obviously, like you said, let them get the help on the next echelon of care.
Summary.
So in summary, so we're talking about personal safety. So, the 3 ABC. So you want alert. Again, when you're talking, you need to call for help and tell them exactly what has happened. Find the bleeding, and I'm saying the catastrophic bleeding, and you can't miss a catastrophic bleeding. They'll be bleeding and they'll be shouting to you because you can see a pool of blood, or you see something that is horribly wrong. Compress, like we said, you need to compress the pressure and or pack it. So for the long ribs, the arms and the legs, you need to put pressure and elevate, and at the same time use the compression system like we've spoken about the bandages. Compress with a tourniquet. So again, we've gone through the tourniquets. If you don't have the tourniquet that you can buy from the shops, you can improvise. Like again, we said about belts, lassos, ties, and t-shirts, whatever you can get hold of. And then again, it's wait for help to arrive or go and seek help. And I'm talking in the likes of Kenya. If there is no ambulance, a lady available, take them to the hospital. Stop any vehicle that is passing by, because the more they stay there, the more all these things will start to happen, and they will either go to shock, then that will happen, and then they will have hypothermia, and then this is like the triad of death. We don't want them to get to that, that level. Okay. So the lesson for today was stop the bleeding. The only thing more tragic than death is death that could have been prevented. So prevention is better than cure. And like we said, we're trying to do these things because those are the basics that will save people's lives. And I'm talking as a Kenyan now, and I've seen what people do. An accident happens, and the first thing they do, they just go and watch. You're not helping anybody when you're just going to spectate. You don't want to be a spectator. You want to go and get amongst it. So there's no one taking charge. You can do that, because whatever you've been taught through these lessons, if you do them and you do them basic, you save that person's life. You don't need to know them. But all you need to do, the best thing you can do is do something other than just standing there and taking pictures.
Thank you so much. So Justin, are you back in?
Yes, I am.
Yeah, so do you want to conclude now? What was your conclusion? Because your internet let you down.
Yeah, having to use my phone. It seems to work better. My apologies, everybody. But thank you for finishing the slideshow.
One team, one fight.
Yeah, you're welcome.
Say again?
You're welcome.
I mean, the summary slide pretty much just, it summarized everything. Identify the bleed, stop the bleed. As far as improvised tourniquets, I wanted to elaborate a little bit on that. There are a lot of commercial kinds out there. You know, companies mass produce them. But I want to tell you about an event that happened in the United States, the Boston Marathon bombing. Quick little research I did. They pulled statistics from this event of 243 injured, 152 patients from this bombing presented to the emergency department within 24 hours. Let's see. In total, 27 tourniquets were applied. It's talking about traumatic amputations, extremities with major vascular injuries, so those vessels. All tourniquets were improvised, and no commercial purpose-designed tourniquets were identified. Among the 243 patients, mortality was 0. So from the single incident, 243 patients. A lot of lives were saved that day just from people remaining calm and doing what they needed to do to identify and stop that bleeding.
You good? That's it?
That's it.
Okay. Thank you so much, Justin. So from all our speakers tonight, you have seen the importance of stopping the bleeding. Yeah, the statistics are out there that hemorrhage or losing blood is #1 cause of deaths. #2 is airway. And #3 is tension pneumothorax, what Sean and Mr. Tirus were talking about. If somebody has an injury to the chest and you don't take care of it, you don't put that chest seal, you don't cover it with something, the pressure builds in your chest. And as the times goes by, if that tension is not released, if that pressure is not released, they're gonna lead to shock, and that shock leads to death. Yeah, so that's how they go, is from massive hemorrhage, which is bleeding for today's topic, then it's gonna go airway, tension in pneumothorax. That's #1, #2, #3, the causes of death in the world. So that's why the importance of this class today. So next time we're gonna see how airway And if you fail to manage airway, it can lead to death too. So this was a very relevant topic especially for Kenya, because you see, these days we have been having a lot of active shooters. So when somebody is shot, if you are not careful and if you don't jump into action real quick, that person loses blood. Death is as close to them as you may not even think about it. So when you see somebody bleeding, improvise everything, anything that you have. Like Mr. Titus is saying, improvise. You can use a belt, you can use your lassos, you can use your turbans, you can use tie, you can use scarf, anything, as long as it will be efficient enough to stop that bleeding. Then if you have stopped that bleeding, now is the time for you to get that person to the next echelon of care. But whatever we'll be teaching is very, very applicable to everybody. It's not just for people in the medical field, because when those guys, they come and hit Dusit 2, they hit Westgate, every person gets injured. And if you're close to them, you'll be the one in charge of saving their life that day. So we are choosing these topics very, very carefully, and we are tailoring them to match and to be applicable to Kenya. But you'll be seeing a lot of varieties. That's why when Titus was talking, Titus is based in London. He's in the British Army. So that's why whenever he was talking, after he's done, I was bringing people from the US, so at least they can complement each other. So at least you can get the feel of both worlds. So, but these topics are being chosen very strategically, because we want to teach you it is very, very applicable on the ground in Kenya. Yeah, so I will just be inviting you every day to be joining us every Wednesday. So at least we can continue with this. So at least we can continue delivering these lessons to you guys. What we just want is just improved patient assessment, and we want to save lives. And that's all we care about. Yeah, so I don't know if anybody has anything. Mr. Sean Vok, do you have anything?
No, not off the top of my head, no. Looking forward to the next one. Yeah. I wish I was there in person. It's kind of weird being on a camera. I feel like I'm talking to myself. It's very weird. I'm not a YouTube star or anything like that. So yeah, it's a little bit different. But no, I got nothing to add. Sorry, brother.
Okay. Justin, do you have anything?
No, sir.
Outstanding. Tyrus, do you have anything from UK?
Apart from greetings, nothing else, man.
Okay. So is James Bailey, are you back online? I think he's gone, but you see him in the next class. Yeah, so that concludes our training today. Today was about breathing. Next class, we're gonna be about airway. So we're just gonna build them on top of each other. Massive hemorrhage, airway, respiration, stroke breathing, circulation, hypothermia, eye injury, and so forth. So we're just gonna build one on top of each other. So at least you guys, you'll be proficient on the ground. So thank you so much. And tell a friend to tell a friend. We'll be having these classes every Wednesday. It's either between 7 and 8 p.m. Because at least today we have had the double number we usually have. So which is very, very commendable. So thank you so much, and be safe out there, and may God bless you and your family. I see you next Wednesday. Thank you so much.
Thank you.
Thank you.
Very happy, Jeff from Kenya.
Oh yeah. Oh, Gideon.
Yes.
Yeah.
Yeah.
We
Yeah,
just
Gideon.
want to say thank you.
Yeah, you guys can say something. That's my team on the ground in Kenya. Gideon and Mary, say something, please.
Yeah, really to thank you, as we started by saying we are meeting women, people who are dealing with households, It may look like it's very basic, but very, very important. We are learning. We have included other people now from Uganda and Tanzania. So we are happy. And I believe that we are learning. So thank you very much.
All right, Gideon.
Thank you, guys. Thank you very much to our trainers for the day. We really learned a lot, and we look forward to next time. Like Jakes has said, tell a friend to tell a friend, because good stuff are happening here every Wednesday. So make a date with us. And in case you've not shared your contacts, please post it here. Maybe I can just post my WhatsApp number, but I had also posted the WhatsApp link to join the chat group for real-time updates. So looking forward to many more. Asante, Jakes.
All right,
Thanks.
Titus.
Can I say something quickly?
Tyrus.
Yes, just a quick one before you go. If you allow me, I
Yes.
want to bring. Yeah,
Yeah.
I want to bring somebody
Yeah,
next
that's
week.
Yeah.
Hello,
Uh-huh.
can you hear me?
Hello. Go ahead.
Yes. So I'm saying, if you allow me, I want to bring somebody next week who is a product of basic first aid. I personally saved that person's life, and he's so proud because he is alive today because of the basic first aid we did on him in December. He's a member of KDF. He's Mr. Wanyoike. If you allow me, he can say something next week on Wednesday, obviously to bring a realism on this training and people to understand why we are actually doing it. So if he comes here, I think he's going on. He's meant to go on surgery, his last surgery, but he's well and alive. So if you want us to bring him as a testimony, he's more than happy to do that, and he'll be ambassador to this cause. Okay.
Yeah, definitely. Definitely
That's
bring
all
him
for
on
now.
board.
Thank you. All right. Thank you.
Okay. Yeah. So, and we need more resources from the UK. So bring
they'll
as
come.
many people as possible.
A lot of followers.
Okay.
Take care.
Okay. All right. Thanks. All right. So from my side here, yeah, see you next Wednesday at 7 p.m. Sorry.
Hey, Jakes.
Yeah.
Before you leave, just sorry I came late because of work. My question was, would you try to push it a little bit, like from 7:30 to, or from 8, or is it too late? Because I think some of us will be missing out a lot.
Okay. Okay. Yeah, I'll converse with my team. I will liaise with my team, and I'll let you know. But it is possible. It is way possible. Yeah.
Okay.
So yeah, there's no problem pushing that time to 8.
Okay.
Yeah, because you wanna get to as many people as possible.
Okay.
Okay. Anybody else? All right. Thank you so much, guys, and be safe out there. Corona is real, and take care of yourself and your family. Yeah.
Okay. Okay.
I was saying something.
Yeah, you're breaking. We can't hear you.
I'm saying I'm EMT called Kevin Odwar.
Okay.
Operating in Kenya. I joined a little bit earlier, but I noticed some of behavior that we need to change.
Okay.
As far as we are joining this, we are learning, and it's like, for me, it's like a CME, a continuous learning in the process, whereby we need to have a proper understanding and all that. Yeah, I noticed that most of the guys are not muting their mics and their videos, which make the Zoom platform to not work good. The Zoom is working well when the presenter only is on with their video, and the rest of us switched off their videos. That is how it normally works well with the presentation and every other thing. So that is the observation
Okay.
that I've gotten, that we need to now.
Okay. Thank you so much for that insight.
Emphasize on it in the next.
Sorry, in the next learning class. Thank you.
Thank
Okay.
you guys.
Okay. Yeah, we'll put that in the next time. All right. Any other comments? All right. Thank you, guys. Thank you, guys. I'll see you on Wednesday. Hey, Gideon. He's gone. I know he's Gideon.
Hi, Jax.
Yeah, so you and Mary, can you remain behind for a minute?
Sure.
All right. Gracias.
Thanks.
My people, my people. Yeah? Leo
Yes, sir.
tumeharibu. Leo tumeharibu.
Yeah.
Leo tumeharibu. Wow.
The turnout was so huge.
Yeah.
48 people. There's even people just joining right now. I'm just saying no. We Kuna watu wanaingia
Yeah,
saa
I
hii.
know. I realize there are some people who are
Kama huyu.
entering now.
Angalia mwingine anaingia saa hii. Leonard Lagat anaingia saa hii.
Yeah, I don't know what
I-
we did. I don't know what has happened. I think we hadn't invited people.
Now, what we did different, first is the time. Then second, I think the poster worked wonders because it was easy to share on other groups, Facebook. Unlike last week.
Angalia mwingine. Sasa niko na wawili waiting. Sasa tuwafanya nini?
Maybe chenye tutafanya ni kuweka end time. Time ya kumaliza.
So we had
poster
48.
next time. Yes, we had 48.
Yeah, so what we're gonna do, and we just made the flyer today, like noon.
Yeah,
so
you
what we're
know,
gonna do for next
flyer
week,
is-
we're gonna do a flyer. Yes.
Yeah, it talks actually.
Yeah.
So I think for
And
next
some
week,
people also
sorry, go ahead, Mary.
We have some people from Uganda and Tanzania now.
Yeah.
Wow. Tunavuka border.
Yeah, I was actually talking to Julius this morning. Julius is the guy in charge of the Uganda team, Jakes. We also work with him. Yeah,
And a
guys
guy
are
called
really-
Frank
Yeah.
in Tanzania.
Wow.
Excellent.
Wow. Yeah, so for next week, because we already know the topic is gonna be airway. So just make that flyer early, and we start sending it as early as tomorrow or
Okay.
whenever it's done, because you already know the topic. Because I can see the wonders that was done as a result of just sending that flyer to different platforms.
Yeah.
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 So
I think
that